And the emphasis, do you think, on recreational, especially in recent years, is diverting attention and resources from exploring its medical potential?
Medical and drug development is usually expensive. There's only a handful. Like we produce the pharmaceutical cannabis report every, where we analyze all clinical studies going on, the conditions. Dealing with a clinical trial involving cannabis is complex in its own right because of the complexity of the plant, but two, it's extremely expensive. Like you've got this major challenge of medical cannabis products, as we know at the minute, in this special zone. And as the longer they stay in the special zone, they won't grow as much as they would do if they were properly approved medicines, like and endorsed by the health regulators. They'll continue to fall within this special zone, and general practitioners or nurses, won't be able to prescribe them. And I don't see that changing, to be honest. Despite the intentions of cannabis companies or even patients, it would be best for all to have a clear separation on what's pharma and medical and what's a recreational user. Because a recreational user, look, they can be recreational and using it for their health and wellness, but it's not tied into the rest of their actual healthcare treatments. It's, there's self-medicating and there's actual medicating. And I think there has to be recognition and acknowledgement of the difference in two.
And I think how you say being rec and medical, I see that a lot of wealthier nations where there is enough money because it's an expensive process to go medical, there is this disparity between the emerging world and the wealthier nations of being able to take full advantage of the crop. Whereas you see entrepreneurs who are outliers, and you see money being invested into the Asian and the African countries where legalization is happening. But this global disparity has existed. But slowly I've seen a trend of goods moving across the globe very easily, as opposed to like 2 years ago. Like it's very easy to transport flour now from Asia to Europe than it was. You couldn't put flour on a plane 2 years ago, but now it's fairly easier. What's your take on this global disparity of sorts?
We did like the first bulk imports of cannabis into the UK. And I remember, having to go with our pharmacist over to Amsterdam to pick it up, take the prescription, go to Amsterdam, bring back the prescription, then give it out to the patient. It cost us, we lost so much money on every prescription that we were fulfilling, but you're doing it to build a market. That has obviously changed, somewhat in terms of the supply chains becoming much cleaner. Look, there's still price arbitrage. There's still a lot of challenges and issues within the supply chain. But I would say for larger part, there is some level of certainty in terms of what the market needs are. So you've got some really, really good companies and businesses in the space who are properly servicing the sector. That's from seed to sale tracking, from distribution, certainly from the analytical and testing side, from the processing side. There is now a more mature market, and those those skills, a lot of these skills are transferable in a global perspective. So they can be adapted. There is the way in which you grow and cultivate and process and extract and so on is fairly universal. There's a lot of universal overlap, and there's great companies that have taken on IP from other sectors and then applied that to the cannabis space.
I would add to this around a lot of companies that I have met in my journey and that are very conscious and responsible on this fact and are helping drive the disparity down, and especially on the medical side of things, get the benefits of this plant and pain management and neuro-related issues.
When you're in the cannabis industry, you think everybody else is talking about cannabis, but in reality, nobody else is talking about cannabis. We live very much in a bubble in the sector. It's tiny. It's tiny when you think of it in comparable to other sectors. However, if we want to achieve there is just a general consensus of reform and access and legalization, then it is absolutely critical that there is a collective responsibility, but also there is a level of openness to share and collaborate. And I do see that, being evident in a lot of businesses within this space that probably wouldn't exist in other sectors. So I don't see that same level of collaboration exist in crypto or, other fast moving industries. I think is those working in cannabis, the mission goes beyond just legalization. It is the knock-on effect of that in society, in terms of us being a little bit more open-minded, in terms of us, being a little accepting other thoughts and ideas, and opening ourselves up to other versions and visions that that are out there and other possibilities out there. It's a small tweak in our outlook that you don't need to be a cannabis consumer. It's nothing to do with consuming cannabis. It's a nonsense idea to work in this sector you need to be a consumer. I don't buy into that at all. And it's more encouraging the acceptance of cannabis as something that can be accessible. It changes your outlook. And then, okay, if I accept cannabis, what else will I accept? What else will I endorse? What else can I see a future, pertaining? And it's looking forward rather than looking back. And I think that's an exciting industry to be part of, that's constantly looking forward.
Absolutely. I think all said and done, I think that's the genesis of it, is to look forward and move past our mistakes and move in a positive direction on medical as well as recreational.